Hi everyone. Obviously not Tony. I'm filling in for him. He actually had a conflicting meeting, so I'm here to fill in. Obviously, our talk will focus a lot more on COVID. Oh, thanks for noticing my Wonder Woman. Yep, right there. My sister gave me that recently, just to commemorate all the work we've been doing. But big Wonder Woman fan, so yes, thank you. Um, Before we get into all the COVID talk, which we're probably going to focus on a lot here, I do want to make a couple announcements on the town side. Do my best to answer any questions about them, but might refer you to the manager's office if we have questions. I wanted to let everybody know of an upcoming webinar at the Chamber. They're going to be going over many federal, state, and local relief options that are available to local businesses. There'll be representatives from the SBA, Massachusetts Office of Business Development, and Seed Corporation, and they'll be talking about the PPP, Paycheck Protection Programs, economic injury disaster loans, and low interest loans from Seed, and a lot more. So I'm hoping Joe will put the link into that webinar if you need to register. Also want to make sure everybody knows about the Mustang's food drive we're having on Wednesday the 27th from 10 to 1 p.m. at the Senior Center. Any support and donations are greatly appreciated, and information about that is on the Feed Nord Facebook site. Also, two important webinars on the town site. There's going to be an information session on for the February 4th special town meeting, and the session is on the 28th, January 28th at 7 p.m. Town officials will be discussing the warrant for the February 4th special town meeting, and town meeting members are encouraged to attend and ask questions. You do have to register for that meeting also, and this is different than the Zoom training meeting. So with the town meeting being conducted on Zoom, then we want to make sure all town meeting members are successful. So they have scheduled several Zoom training sessions. They're for town meetings only, and town meeting members. You only need to attend one session, but there are more, and you're welcome to attend more if you have some extra time on your hands. And again, you have to register for that on the town website. We'll put links to that in the chat. A couple more announcements. The town's going to look into having a trial period for evening hours at the landfill. I think we've gotten some feedback from residents that they might be interested in that. Thinking sometime in May, so stay tuned to hear about that. And also, I know my own department and the general manager's office has been receiving a lot of questions about coyote activity. So we have been trying to post some information on social media. There's great information on the State Mass Wildlife website. The short story is we obviously really don't want to feed any wildlife, and especially not coyotes. And the idea is that we want to make sure that they're fearful of humans. So what we say is you want to harass them. What that means is just if you do see one, make loud noises, clap your hands, anything that makes a loud noise that might startle them, because what we want to do is condition them to actually not like to be around us. They're in our area, they're backyard wildlife. There's not much we can really do about it. You can't move them, you can't kill them. They're part of living in a suburban area that we're going to have backyard wildlife like that. And actually, Henry and I have been Henry, the animal control officer, and I have had discussions with Mass Wildlife about it, and they've been very informative. But the short story is don't feed them, and make sure to try to harass them or make loud noises when you do see them so they don't get comfortable being around us. Last, the Norwood Trails Advisory Committee invites the public to join them on the next walk. This will be Sunday, January 24th at 2:30. We will be walking through the town conservation property off University Ave, dressed for cold weather. Make sure I got all these details. We will meet at the hot dog stand road cutout just across from Home Depot warehouse entrance. The walk will be over by about 5 p.m. Of course, masks and social distancing policies will be in effect, and definitely stay in small groups and safe distances from each other. Questions can be directed to trails@norwoodma.gov. And thank you for putting all those links in the chat. I just want to look through the chat, if we had any questions on that. Great. So before we really get into the COVID numbers, and I definitely want to talk about some vaccine updates, because we have a lot of great news about vaccine coming out, but I just want to go over some recent announcements today, more on the policy side. ago, announced some changes. Effective on Monday at 5 a.m., the stay-at-home advisory will be rescinded. So that was the advisory that asked people to stay home between 10 p.m. and 5 a.m. So that will be no longer in effect on Monday the 25th. Also on the 25th, the mandatory early closing of business orders for certain specific businesses that they would close at 9:30, that will be also rescinded. So what that means is restaurants, arcades, movie theaters, golf facilities, zoos, botanical gardens. I'm looking at the list here. Fitness centers, gyms. That's a lot. We have, looking at the things that we have in indoor, outdoor pools. Nobody's really going outdoor pools right now, but indoor pools, those can stay open past 9:30, and gatherings may go beyond 9:30 p.m. That was just announced today. The occupancy limits of 25% occupancy still remained, and the gathering limits still remain, and those are limits of 25 people outdoors and 10 people indoors. So those remain into effect until February 8th, and we don't know if that will be extended beyond that. But those are brand new announcements today. Got a question. Do you happen to know about the traffic light in Neponset Street and the Hatton Rotary will be replaced? Great question. Save that for next week. I'm sure Tony might have an answer, or you can always email managers@nordma.gov. Sorry, I don't have an answer for that. So I'm going to get a little into, I think Tony usually starts out with talking about some of our data and our numbers. Just again, we just received the testing data. So each week the state releases data on a town-by-town level, and it incorporates a 2-week period. This week's report, which will come out tonight, covers the time periods from the 3rd to the January 16th. During that time period, we saw a slight increase in the number of cases. So last week's report, we had 291. This week we'll have 303. I consider that pretty level. That's not a huge increase or decrease. It's pretty much about the same, pretty flat. But what we did see was a good drop in the percent positive. And that information is given to us a little before the state report comes out. So we get it. It's not information that we have access in our databases. While we do have access to case numbers, we don't have access to testing numbers. So the state provides that to us on a weekly basis right before their evening reports come out. So we just received that data, and we have a great decrease in the percent positive, which means good. So last week we were at 7.25, and this week we will be at 6.67%. So what does that mean? These are a bunch of numbers I'm throwing out. So because we saw, our case levels were pretty flat, like I said, but a drop in percent positive is a good sign. So that means our testing capacity is keeping up with the cases as they're increasing, and in fact is doing even better. The fact that our percent positive went down, the more you test, the lower your percent positive will be. So it's a sign that things are headed in a better direction, although I'm always cautious. This is a week to week, and when we look at trends, we want to look over several weeks. So cautiously optimistic that that's a good data point to see that number going down. Overall, in the last few weeks, things have been pretty level. We have not seen huge increases or huge decreases. Of course, we always want the number to go down, but we're not seeing the increases that we saw back more in November and December when things were climbing pretty steadily. So I think that's a good sign, hopefully reaching the peak. And we should say that that's not just in Norwood, that is also across, if you look at the state numbers also, things are definitely leveling off. Just want to make sure you look at the questions. I'm not as great a multitasker as Tony. I have to read and I have to stop talking when I read. Great. So vaccine, this is the next big hurdle and challenge for local health, but also very exciting because I feel like those are steps that are really going to take us to the end of this pandemic. So the state just determines really who gets the vaccine and when. There's a phased approach, which allows the highest risk and those most affected by COVID, by the virus, to get the vaccine first. That's the whole idea behind the phased approach. We are currently in phase 1 of the state's distribution plan, and those included in phase 1 are healthcare workers, first responders, and those living in long-term care and congregate care. And again, that's based on their exposure and their risk and their burden of disease. We know that people living in closer quarters have a higher risk of getting COVID. We hope to move to phase 2 at some point in February or March. And then in addition, each phase 1, phase 2, and phase 3 are broken down into further subcategories. And the first subcategory at the beginning of phase 2 would be individuals with 2 or more comorbidities. And that's, illnesses that put you at higher risk for complications with COVID. Also, individuals 75 and older, and residents and staff of public and private low-income and affordable senior housing will be eligible. So housing authority units will be eligible right as phase 2 opens. And again, hoping that's at some point in February with the beginning of phase 2. Also, I'm going to keep mine. Great, and there's great links here to more details about the phases and on the state website. And I should mention that the state website is updated regularly. It actually every Tuesday and Thursday. So things, as far as the phased approach, things are constantly changing, and as different input comes in and different information. So I would make sure to check that pretty regularly. That's a great question. How will people prove their morbidities? I think the state is actually still working that out. What I expect to see is some sort of attestation form. Obviously, if you get it from your doctors, they'll know. And let me just jump back to say everybody is that can vaccinate will be vaccinating. So you'll be able to get vaccines at the health department, at the local pharmacies. You'll be able to get vaccines at your doctor's office. So if you have serious health conditions, you might want to consider getting it at your doctor's office. But everybody will be vaccinating. We're probably going to do a bit of an honor system and asking people to sign an affidavit. That has been a lot of the policies with the state when they talk about businesses and following the rules, that people sign off that they are doing the right thing. A lot of the whole pandemic response really relies on people doing the right thing for the greater good. When we're talking about quarantine or getting tested or following in the order for the vaccine, all of it just relies on everybody doing the right thing. After that first category, it really opens up to what they're calling, they just call it other workers. And it includes things like teachers, food workers, a lot of public works and utility workers fall into that category. That is a very long list. And again, more details on the website. And at that point, we really hope to be having a lot of vaccine flowing into providers to be holding large clinics. We will do targeted clinics. A lot of those other workers are actually municipal employees, which as the health department, we're really well staged to vaccinate. Should go back to mention that I think a lot of people already heard, but we vaccinated our first responders all of last week, and we were able to provide vaccine for our police and fire departments for anybody that wanted it. We had clinics right at the station for them to make it as easy as possible. And we can do similar models with the schools and with public works and our light department employees as they become eligible. Early on in phase 2, we hope to have clinics specifically for them. But we will also be holding public clinics that'll be open to anybody that is eligible. And all that is able to be searched on the state website. Any sense? So I'll get to that, Sarah. That's a great question. So all the sites that are administering vaccine have to be on the state website and have to list how you book an appointment. So any sense where in your department will get vaccine. Well, that's great to hear that you got it because you're a healthcare provider. That's great, and that's qualifies in phase 1. So we received an allotment to do specifically first responders, and right now we're waiting for our second allotment. We hope to get more vaccine next week. We currently do not have any. We got a very small allotment to do our first responders. So our hope is that we begin to really start to get vaccine now that they've opened up all of phase 1, which also includes non-COVID facing healthcare workers. That does open it up. Dentist offices, chiropractic offices, PT offices. So all those are now qualified to get the vaccine. So we would definitely be in a good position to offer vaccine. And like I keep saying, anybody that can vaccinate needs to be doing it so we can get as many people vaccinated as possible. We will have a link. So I should say what's really different about what's great actually is the state has purchased an online clinic management and registration system. So if anybody's attended our flu clinics, we deal with a lot of paper. So we even would mail the paper to the company that helps us bill health insurance to get reimbursement for the vaccine and the administration. So we will be using the PrepMod system. It's going to be, like I said, an online registration system, and links will be provided both on that state website for public clinics and specific links to targeted populations for the closed clinics. So all of our clinics, you will register, you will get an appointment. We have to really follow the appointment base. It's really hard to accommodate walk-ins with the Moderna vaccine, which is what we're using. It comes in 10-dose vials. And we have to, once you puncture the vial, you have to use those 10 doses within 6 hours. And nobody wants to waste even a single dose of this vaccine. So we have to make sure that we schedule appointments in factors of 10. And obviously, we need to control for how much vaccine we have. We don't want, 1,000 people coming if we only have 200 doses. So we will be using that PrepMod system. Very easy. You can do it on your phone. It's actually the best way to do it's on your phone if you have a smartphone, because we do ask that you take a picture of your health insurance card, because we do bill. Obviously, the vaccine is free, but we do bill health insurance for the administration. And then, just like I always say with flu, it's a little bit of town pride to get your vaccine from your town, because then we do get the reimbursement, which we can put into other public health programs for our community. So pretty good reimbursements rates, and that's why I think, which is a good thing, and that's why I think you'll also see a lot of private entities administering vaccine, because they can make a profit off of it. I talked about a little that we'll be doing the Moderna vaccine. It's mainly the Pfizer vaccine is held at such cold sub-freezing temperatures that we just don't have the capacity to handle that, and it also comes in very large capacity. I think it's over 900 doses in one shipment. The Moderna vaccine comes in 100 boxes of 100, so 10 dose vials. They don't like to ship less than 200 just because of the logistics of it. But so we will be using the Moderna vaccine, which we have the capability and the experience of handling vaccine. Most people know we do flu vaccine, but we've done some other vaccines over the years, such as the shingles vaccine. And in earlier ones in that. And we also did the H1N1 response, which is obviously a flu vaccine, but we were able to handle that more in large quantities. So we have the proper vaccination storage here in Town Hall. So the Moderna vaccine, it is approved for 18 and older, and it does require 2 doses 28 days apart. The state really is encouraging people to get their second dose at the same location where they got their first dose. In fact, I think they're pretty much requiring it for the fact of making logistics a little easier. So they will automatically ship second doses to the locations where they shipped the first dose. So we did our first responders last week. They will send us the same amount of doses to do, when they reach their 28 days, which I believe is the second week in February. February 8th, we will be doing second doses for our first responders. And so they will ship us off the vaccine. I talked about the PrepMod system, so it's really exciting. I think it'll actually, it actually makes for a much quicker clinic too. So again, if anybody's been to our flu clinics, they do tend to go a little slower because we're doing paperwork. Where we use the PrepMod online system, there's no need to register on site. You pretty much your vaccine pretty quick, but there is a 15-minute waiting period after your vaccine, which is pretty standard for any new vaccine that's out there. Just want to make sure to observe people for 15 minutes for any allergic reactions. Very little reactions. We haven't seen any in the small amount that we've done, but it's just a precautionary measure. I registered on the state website. I'm not sure what you mean by registered on the state website. For the vaccine, I'm not aware of any registration. If you have a link, you can put it in the chat and we can check it out. There's no place to really register. We're not really taking a waiting list or anything like that. A lot depends on the vaccine we're going to receive. And there's going to be so many outlets to get vaccine. I don't want somebody committing to one and then getting it somewhere else and giving people really false hope that they're going to get it immediately. So I don't know of any registration for vaccine unless you mean something else. There's a great map on the state website, and we will be up on it next week as vaccinators. Once we get some more vaccine, we will be a little pin on that map as a site where people can get vaccine. We won't actually go up until we receive the vaccine, obviously. So that was my big spiel about vaccine. One more thing, I'm sorry. There is a great system that the CDC has stood up, which is the self-registering. You can choose to sign up for it if you want. It's the VSafe system, and it's a smartphone-based app that uses text messages and web surveys to provide personal health checks after you receive the vaccine. We obviously want to gather as much information as we can for people that get the vaccine. So you can do that if you choose. It also reminds you when to get your second dose, which is obviously very important. Either the Moderna or the Pfizer vaccine. If you get either one, you can register for that if you choose. So definitely welcome any vaccine questions or any COVID questions. I guess I could also share, I heard it's pretty hard to share your screen on here, and I know Tony usually uses the paper graphs, but I am obsessed with data. So I'll show you my graphs because I'm really proud of them. This was when the state started color coding the towns. We started this looking at both the rate and the percent positive. It's hard to do. There we go. So that's the orange line is what I was talking about earlier with the percent positive trending down a little, which is a great thing. But that our rate is kind of flat. You see it going up and down a little, but has been flat for several weeks now, which is a good thing. What we want to see is that starting to come down now. And again, this is posted on our website every Thursday evening. The other graph, which I find is really telling, is our testing. And I know these numbers are really small, but the point isn't to see the week-by-week numbers. The point is to look at the overall trend. And so the blue lines are the negative test, the red bars, the blue bars are the negative test, the red bar is the positive test, but the green line is the percent positive. So if you look across, it's really hard to do. You can kind of see the trend in how much our testing capacity has increased. This is all the way back in March to way down here, where you see our percent positive is huge, because we know back in March and April, we weren't keeping up with the number of cases that we were testing. We didn't have the testing capacity that we do now. Testing turnarounds have been great lately. We did have a period of time, and it's been fluctuated through the pandemic, where testing has taken, there's been a backlog in testing, and we saw delays where it would be 4 or 5, 6, 7, 8 days. Well, more like 7, 8 days to get test results. Now things are back pretty quick. Would say the Norwood Hospital testing trailer has very good turnaround times and always has since it's been open. So that's a great place to get tested. You do need a doctor's order for that. But there's plenty of testing available in this area, from the Stop the Spread sites to healthcare providers, and like I said, the Norwood Hospital testing trailer. So we're lucky to have those resources. We are still contact tracing. We have reallocated our resources towards the vaccination effort, which means on the contact tracing side, we are sending more cases to the Community Tracing Collaborative, which is the state backup system that was set up quite a few months back to handle some of the contact tracing that happens. So if you do test positive, you might get a call from the CTC. Encourage you to answer it and comply. I am a little cautious about that because I think people are more likely to comply if they get a call from their local health department and from a name or face that they know or that seems like a part of their community. So I think people are more likely to comply if they have that connection. But understanding that we have limited resources, and I think we made the decision to reallocate things towards the vaccine. So I think that's really what's going to get us out of this pandemic. Within the schools, the school nurses have been doing an amazing job. We've transitioned some more work on them. I want to thank them for their partnership in this, and that they are doing a lot of the tracing in the schools too. So when there's a case in the schools, they sort of do an isolated tracing within their buildings and their facilities. And then we can handle the community exposure or send it to the CTC. Different times during the pandemic, the CTC itself has been overwhelmed, so they also triage the cases that they're going to call back. But from what I understand, they're pretty caught up and are able to keep up with the capacity at this time. Just scrolling through. Did I miss any questions? If I missed your question, feel free to type it in again. I'm trying to think of some of the other initiatives we have here at the health department. We are been pretty consumed by COVID over the last year. Oh, thanks. Public Works. I should talk about the great partnerships we have. And I've seen some of my colleagues across the state have some difficult times, uh, politically, and really allowing their health departments to respond appropriately to the pandemic. They've had some backlash, and I always say here in Norwood that's not the case, because Public Works is thanking us. Our police and fire chief have been very supportive and worked closely with us to get their staff vaccinated. Public safety has always been great partners to the health department. And I'm just fortunate to have the support of the general manager and the selectmen. Of course, the Board of Health has been very supportive and helpful in our response, that we're very fortunate here in Norwood. I always say we always want to do more. We're always looking for more programs and more resources to bring to the community. But knowing that we have community support is very helpful during this difficult time to respond. Thank you. Thanks, Joe. We do our best. I know there's a lot of information and it's constantly changing. I should say also, the partnership with NCM, we're so fortunate to have them too. That being able to communicate through that platform is very helpful and reaches different people that might not see something like this on social media. I think our struggle when we always talk about, equity and really reaching the population with our programs is that, what about the people that aren't connected to social media, that are connected to NCM, whether it be language barriers or other cultural barriers that we can't reach? So we're always trying to brainstorm on how we can reach different populations in town. And I think when we think about the vaccine effort, it's really important to try and target people that have been most affected by it. So we always appreciate, information or people coming forward on how to reach different populations. We obviously work really closely with the senior center, and I think when we talk about the online, there are plenty of seniors that will be able to manage the PrEP mod system. I don't want to generalize here, but when we talk about an online registration system, we're really going to rely on the senior center to help people that can't navigate through that process. And the same thing with the housing authority. They're fabulous that they have staff that will be able to help residents register through that process. So fortunate to have them also. Great. The rec department, of course, thank you. You guys are great partners too. When we talk about community engagement, you guys are definitely in the lead, and we like to partner with you on that and so many things. So thank you. So if there aren't any more questions, I don't think we need to draw out the hour, but I really appreciate everybody taking the time. Give it 1 or 2 more minutes if anybody has any other questions. Can't believe nobody has vaccine questions. We get, not exaggeration, about 20 to 30 calls a day, people asking about vaccine. But unfortunately, we have to direct people a lot to the state website because that's the latest and greatest information. And we continue to try and do things like this on social media and with NCM and really use all our platforms. Or I should say, if you haven't already, and I'm sure most people on this have, but if you haven't signed up for the Swift Reach system on the state website, which is the reverse call system, to definitely go ahead and do that and spread the word about that. Because when we do have large general public clinics, we will be using that system to notify residents. And that is our goal. We really feel like we're a little bottlenecked here with the restrictions on the vaccine, but once it starts flowing and we can open up into phase 2 and phase 3, we will be holding large clinics in the high school and the senior center to get vaccination in as many arms as possible. Is it true that people need to be observed for allergic reactions? Yes, you do need to sit for 15 minutes after you get your vaccine just to see if there's any reactions. Very few reactions, but it's just standard with a new vaccine that we want to observe people after they get their vaccine. One of the reasons why I'm not too keen on the drive-through clinics, they have some protocols where they can observe you in your car in a drive-through vaccination clinic, but I'd prefer to have people in the room where we can have eyes on them. So the nursing staff that is vaccinating is obviously there also if something does happen. And we're required to have EpiPens and proper PPE and all the medical necessities for a clinic, and we have the capacity to do that. So, Joe, that's a great question. So, what are the options for anyone that has allergies that eliminates them? So, it's definitely one of the screening questions, and to look at the ingredients of the vaccine and ask your healthcare provider if you think you do have an allergy to any of those ingredients. That's always the situation with vaccines. There's going to be people that can't get them, and that's why we rely on everybody else doing the right thing. Like I said, during the pandemic, it's a community response, and we need as many people that can get vaccinated to get vaccinated. There'll always be people with health conditions that can't. But what I'm sure you hear in the news a lot about herd immunity. We need to get to a certain percentage of people vaccinated in order to stop the spread, and that's what we're looking at doing. But there'll always be people that just can't get the vaccine for medical reasons. Oh, another great community partner, the Friends of Norwood Center. We've been partnering with you a lot more lately, and I think that's one of the positives coming out of this pandemic. I think people we've been finding new partners by trying to get information out and working with businesses in town. We actually not only working with the restaurants on the constantly changing guidance, but also working. We held a flu clinic with the Friends, so great partners there. And I reached out to the chamber trying to get information on businesses that might have employees that are eligible to get vaccine. So always looking to reach out and partner with community partners. Just that's what public health is. It's always about forming partnerships and collaborations. All right. Well, again, I thank everybody. I hope it was informative, and I appreciate you taking the time to watch. Thank you. Oh, I'm back. Joe had a question right as I almost hit end. We're focused on the vaccine rollout. What's your prediction about future vaccinations? Oh, that's a great question. It's unfortunately one of my constant answers is we just don't know yet. I'm gonna guess, don't hold me to it, that we're gonna, it might be like a flu vaccine that you need to get it annually. We've already seen that the virus has changed a little. They do think that the existing vaccine will cover some of the variants that they've seen. And that the variants that they've seen, why they might be more contagious, do not have a higher mortality rate, but that does mean more people will get it, which means there might be more deaths with some of the variants. And I think they have documented the variant is in Massachusetts. So I think there's a very good chance it might become like the annual flu shot, and that you get your annual COVID shot also. So there's a very good chance of that, but it's a kind of wait and see. We don't know at this point. And the other unfortunate thing is that even once you get your vaccine, we still have to follow all the restrictions that we're doing now until we get to a certain point where we have that herd immunity. We don't know about transmission. We actually don't know about that with any of the vaccine preventable diseases, about the likelihood of transmission once you're vaccinated. But the point is, if there's enough people vaccinated, then it won't transmit through the population like it is now. And that's why the vaccine will be so advantageous in ending this. Questions. I am glad I invited. Okay. Well, again, thank you. I appreciate you taking the time. Have a good evening, everyone.